You know, one of the biggest times in our lives is when a new baby is born. And whenever you have a child, or even from the point where you start planning a child, you want to be sure that the mom's in the proper care, in the best care, and of course after the child is born, in wonderful care. Well, today on the show, we're at Singing River Hospital, part of Singing River Health System here in Pascagoula. We're talking to OBGYN Dr. Taylor Banahan. How are you?
Hi, I'm great. How are you?
I'm wonderful, thank you. First of all, tell us a little bit about yourself and as to why, out of all the different fields that you could get into, why as an OBGYN?
So I chose OBGYN mostly because I like taking care of women. So it's the only field in medicine where you can choose to only take care of one gender. And I have a special place in my heart as a fellow female to take care of other females. I especially like, kind of how you were talking, the pre-conception area of
You
life.
start planning it.
Where you start
family
planning and
yeah.
kind of thinking about it, or family planning on the other end where we're not quite ready for a baby and we want to prevent it with some type of contraception. So I enjoy that part of our field all the way through the reproductive years where we do take care of our pregnant moms and help them build their family. And I also enjoy taking care of my older patients as well. So not many people talk about menopause and the symptoms that go with that, but that's also a part of life.
Yes,
And it's not always the most pleasant part. So I enjoy helping women with that as well.
Well, here at Singing River Health System and the Singing River Hospital, I mean, y'all really pride yourselves on the labor and delivery area, the whole women's area upstairs on the third floor. Tell us about some of the innovations that you have here.
So we have a great women's services department. Our labor and delivery is state of the art. It's very newly renovated. All of our facilities are very nice and clean and kind of, state of the art. This is one of our typical
and I see
rooms.
This, I mean, I can remember back when my daughter was born almost 40 years ago, how, it was just kind of a small, you didn't go into the, I didn't even get to go in the delivery room when she was born. Go have the typical delivery room. But here, this is nice. I walked in here and it's like, wow.
Yes, we're very proud of our labor and delivery birth suites. So a lot has changed, over the last generation with the childbirth experience. We try to make it more enjoyable, more family oriented. A lot of the dads in the previous generation, like you said, weren't even in the delivery room.
Right.
Well, now we encourage them to be here and be that support person for their significant others and to be present for the birth. So typically, a female will come in, she'll present in labor to one of our triage rooms. Once she is admitted, she'll come in here. She'll spend majority of the day, some women labor for 12 to 24 hours, some labor quickly in 2 hours, but they come in here, so we try to make it comfortable in case they're here for a number of hours. They will be in these birthing beds. This, is like a typical bed until it's time for the actual delivery, and then it kind of breaks down into a birthing bed, so they don't have to change rooms or anything like that.
So it's all done right here?
It's all right here. And then once it's over, we break it back down into a regular bed to keep them more comfortable for part of their postpartum stay.
And you even have the place over here to put the baby and weigh it and everything after it's born, and turn the light on, keep it warm?
Yes, so this is the warmer for the baby. Part of our new kind of baby-friendly initiative that we're trying to do at Singing River includes keeping the mother and the baby together for a lot of that transition period immediately after the baby is born. So we try to do lots of the evaluations of the baby and any of the injections or vaccinations or any of the care that the baby needs. We try to do that all in the same room so that the mother and the baby aren't split and that they're together.
Well, I mean, you remember the olden days, and you can see some of these in the movies where, after the baby is born and everything, it's almost like the viewing area is just like a big window with baby, baby, baby. It's like, which one's yours? I'm not sure.
Right.
With this, you don't have to worry about that.
Exactly. So we've really cut down on a lot of that, the baby going straight to the nursery and being isolated in their own little isolette or crib, and try to keep them right here with the mom, either on the warmer, or a lot of times we'll do skin to skin, which means as soon as the baby's born, we'll place them on the mother's chest and they start that bonding right there within seconds of delivery.
And keeping them in here that close, again, it is a better bonding thing for the whole family. I mean, mom, dad, the baby, and everything down the line.
Exactly.
Talk about working with about breastfeeding. I mean,
Yes.
that's something that you strongly recommend for a new mom to do.
Yes, we really do. And here at Singing River, it's a privilege to work here because that is kind of a focus, and we are really trying to improve our breastfeeding outcomes. So Mississippi actually has the lowest breastfeeding rate in the country.
Really?
So we're trying to, start some new initiatives here to try to encourage and make sure that we've got the right resources for our moms. So here we have a breastfeeding resource at both hospitals, the Ocean Springs location and the Pascagoula location, where we help to educate the moms, make sure they've got the support that they need, as well as the right equipment. A lot of equipment goes with breastfeeding that people don't realize, as far as their pumps, their nursing supplies, the things that you clean all of your parts with, that kind of stuff. So we're really excited about kind of our new breastfeeding initiative that kind of also goes with the baby-friendly initiative that I was just alluding to. We now know that breastfeeding is more successful when we do keep the mom here in the room with the baby.
Breastfeeding is a lot more healthy for both the mom and the baby.
Exactly. So we definitely know that outcomes for the baby are much better. It's it's the natural, perfect nutrition for the baby. It helps their immune systems. It helps pass on those antibodies from the mother to the baby. It also kind of makes sure that we are feeding the baby on the baby's schedule and demand. The
Right.
baby's not being underfed or overfed. They're feeding until they're full. And so that helps with their growth and development as well. It also has a lot of maternal benefits. It helps get our moms, back to their pre-pregnancy weight. It burns a lot of calories, which people don't realize. It also kind of helps with their postpartum bleeding and things like that most moms are ready for that to end as quickly as it can. And
Wow.
breastfeeding helps with that
And
as well.
any kind of postpartum depression as well. I'm sure it helps out some of that as well.
It could, yes.
It could. Okay. Dr. Vanahan, thank you so much for all the information that you've given us. I mean, the facilities here are absolutely amazing that you have. I mean, I know that y'all are very proud of them.
We are.
And I know you work closely, again, with your patients from, early on to make sure that you're staying healthy through the pregnancy, which is very, very important, and doing the proper things that you need to do. And of course, all the way up through, time to have the delivery and time to go home. So again, thank you so much. You'll have
You're
a
very
wonderful
welcome.
facility here. So if you'd like some more information about all the wonderful things that they do offer with the offices of Singing River Health Systems here on the Mississippi Gulf Coast in Jackson County, and especially here at the prenatal, the OBGYN, and all that information here at Singing River Hospital in Pascagoula.